Excuse me, could we talk about a problem you may have? The one nobody wants to talk about. It's going to be hard to discuss, but it's about going, or not going actually. It's about rarely having a bowel movement, about difficulty having a bowel movement, about abdominal discomfort, about... See? Told you nobody wants to talk about it. It's embarrassing, frustrating, but you know what? It's a real medical condition. It even has a name, chronic constipation. Thing is, it may not even be caused by something you did, or didn't do, and loads of people have it. Up to 28% of all Americans, twice as many women as men, and it affects older people more than younger. But like you, they suffer in silence, not talking to anyone about it. Not even with their doctors. But like I said, it's a medical condition. Chronic constipation deserves medical treatment. Not the silent treatment. Besides, there may be treatments that you don't know about, but your doctor does. And we'll get into that. First, though, do you think you might have chronic constipation? Well, when you visit someplace new, do you check out where the bathroom is first? You know, making sure it's away from people and private enough. Do you say you'll be right back, but then get embarrassed when you aren't because you were in the bathroom too long? Ever canceled plans with friends or family because you were constipated? Or stayed in on a weekend waiting and waiting for the medicine you took to work and not knowing what to expect or when it'll work? Well, you're not alone. Like I said before, lots of people have it and have experienced exactly what you have. You should know that there are lots of causes of chronic constipation, and most all of them are out of your control. It could be a side effect of medicine you're taking, or caused by another condition you have. Maybe a muscle thing. Muscles that control your bowel aren't working right. Or muscles in your lower pelvis, which is a normal part of aging. Could be a fluid imbalance in your bowel, something that can't be fixed by drinking more water. Sometimes even doctors can't figure out what's causing chronic constipation. Then they call it idiopathic, which is a fancy word for unknown cause. Even though you or your doctor can't figure out what causes it, you can still recognize the symptoms and speak up. Still not ready to talk with your doctor? Well, let's review the symptoms, like not having a bowel movement at least 3 times in a week. Now, it's true that everybody's different. Some people go 3 times a week, others 3 times a day. But going fewer than 3 times a week, that's a sign. You have difficulty passing stools? Straining during bowel movements? Maybe you have hard or pellet-like stools. What about abdominal discomfort? Bloating. Feeling like your bowel's never completely empty. Or if you never have a loose stool. If you say yes to 2 or more of those questions, and if you've had them for any 12 weeks over the past year, you may have chronic constipation. And chances are, you need help. Because chronic constipation won't go away by itself. But what about inside your body? Let's take a look. Oh, thanks for pulling that down. The only part about your digestion you control is what you eat and drink. That's it. The rest, your body takes care of. It takes 24 to 48 hours to completely digest or break down food and drink into nutrients. Your body needs them to work right. Now, what's the digestive system? It's a series of tubes, or organs, that connect from the mouth to your rectum. They've all got muscles to keep the food and drink moving and mixing through the tubes. Along the way, nutrients get absorbed in the small intestine. What's left over is mostly fluid and waste that's pushed into your colon. And this is where constipation can occur. Your colon absorbs fluid and releases fluid, moving stool towards your rectum. These fluids have to stay in balance to work properly. They form waste, but keep it soft enough to move out. Muscles in the colon contract to move stool too. Now, if those muscles move too slowly, or if your colon absorbs too much water, stool gets hard and dry. It becomes a problem. And if it gets too difficult to expel, that's constipation. If this happens time after time, that's chronic constipation. But what about treatment? Well, let's ask an expert. Could you see if Dr. Chang's available?
If you've noticed you're constipated, there are many treatments you may have already tried. For example, some people increase fiber in their diet, drink more water, exercise more, Even try over-the-counter medications such as laxatives, stool softeners, and lubricants. But these treatments may not give you the relief you need if you have chronic constipation. When patients come to me, they may have already been suffering from constipation for months, sometimes years. They're frustrated with everything they've already tried. I may write one of 3 kinds of prescriptions for their condition. One helps coordinate the muscles in your intestines. Then there's prescription laxatives, but they're usually only for occasional constipation, so that would depend on my diagnosis. And the third, the newest available, improves your intestines' natural fluid balance. So you see, there is help. Talk to your doctor about chronic constipation. We doctors are here to help.
You heard what the doctor said. Maybe it's time to talk to your doctor about your chronic constipation. Go ahead. Speak up. Talk to your doctor.
Hi, Dr. Chang.
Hi.
I have chronic constipation.
Do you want to tell me more about it?
Yeah,
If you have 2 or more of these symptoms for any 12 weeks over the past year, you may have chronic constipation. So continue the conversation about constipation. Talk to your doctor at your next appointment. If you want more information, call 1-877-553-8782 or go on the internet to www.letstalkconstipation.com. Thank you.